Hi baby wearers, it's Lisa and I'm going to demonstrate a hip carry for us this week. This is called Poppin's hip carry and I'm going to show you a poppable version of that, which means you can pre-tie it and take baby in and out of it. This is a great carry for nursing. Hip carries. Okay, honey. Hip carries in general are great for nursing because you tend to have baby lower into the side. So I like them for that reason. But if you're wrapping a smaller baby who's not ready to be on your hip, you can always adjust any hip carry to make it more centered on your body. So what we're going to do is we're going to start with our middle marker, and you want your middle marker wherever the middle of your child's back is going to be. So if you're going to have your child more on your hip, you're going to put the middle marker more to the side. If you want your child in front of you, you'll put the middle marker in the center of your chest. Also, whenever you're doing a hip carry or a carry that loads on one shoulder, I usually tell people to have the pouch of the carry, to be the side you would normally hold your baby on if you're just holding your baby. I've always held my babies on my left side over my heart, and I'm right-handed, then I have my right hand free. So I'm going to go on my left. If you like it the opposite way, just kind of reverse my instructions. And I'm wrapping a 2-year-old, so I'm going to go more on my hip. And what I'm going to do is come behind me, grab that top rail, and bring it up over my shoulder. I want to be sure not to twist the wrap when it comes across my back. Okay, and then I'm going to kind of gather this up strand by strand, starting with the bottom. And then I'm going to make an anchor point here with the wrap. This tail that comes over your shoulder is going to go across the tail that comes under your shoulder. So we start this carry with a rebozo pass. This is a rebozo pass. Going over one shoulder and under one shoulder is called a rebozo. So again, this comes on top. The other nice thing about Poppin's hip carry is it's really pretty and nice to look at, especially if you have a wrap that has really distinct different sides. It's a good carry for showing off both sides. Okay, so now I'm going to take this part that's coming under and wrap it back over. And I'm going to kind of keep that bunched. Now you'll notice I don't have a huge amount of room here. I'm pretty tight up against my body. I'm going to take this, keep it bunched, and then I'm going to come over here and tie just a half knot. So here is where it's poppable. This is the point where you would get your baby. I want to take note of a couple of things. I have this pretty tight. You probably want it tighter than you feel like it should be, because the tighter you have it, the less adjustment you have to do once your baby is in. If you have this pouch really, really loose, you're going to have to do a lot of tightening once you get your baby in. So you want it pretty snug to your body, and that'll help you not have to make very many adjustments. So now we're going to get our baby. Come here, buddy. I have a very unwilling toddler these days at wrapping. I'm going to have to steal a baby for doing these videos, I think, pretty soon. But you're going to want your baby up on your shoulder, and the legs are going to go through both inner and outer passes of the wrap. So you just put both legs through there, pass them through, and then you're going to pull the inside part up baby's back, and then we're going to take this outside part and also spread it up. And then we're going to make our seat. We're going to go back to this inside layer, take the bottom rail, be sure you get that knee to knee and tuck up between you. And then this part is also going to spread. With a small baby, it's very important that you are pulling the wrap up to your child's neck. It's not as important with a big baby like I have. Okay, so this is pretty much the finished carry. It's nice and smooth across his back. You can see I really don't have a whole lot of adjustment to make. If you got this too loose, what you're gonna do is just come through here and you're gonna pull out any slack you may have. So I pull on the top rail. I don't really have much slack at all, so I'm doing pretty good. So then you're just gonna tie a double knot. Also, I used a size 5 for this. Obviously, I have a lot of tail left here, so I could have gone smaller. And if you're smaller than me, you can use, obviously, a smaller wrap, maybe a 2 even, or a 3. So we want to finish with a double knot. And then you just can adjust the carry however you like. I like to spread this out. Find that bottom rail, spread that out across my shoulder. Be sure it's nice, spread nice and flat across my back. Okay, and then if I wanted to nurse, he's in a great position already for nursing. I would just take my breast out and latch him on from here, and there's really not a whole lot of adjustments I need to do. I can move him more to the front, or if I wanted to nurse on this side, I can, I can swing him around however I want. It's a nice, pretty easily adjustable carry, and it's pretty. Thank you.